All right, I see some people are still joining. Hi, everybody. It's me, Dr. Adams. Welcome to Full Circle's Practice and Pregnancy Orientation. I'm going to be sharing my screen in just a moment, so please let me know if you are able to see the presentation by raising your hand. Fantastic. All right, so a couple of housekeeping items. One, everything we discuss today will be confidential. So you're raising your hands and I can see who's raising their hands, but no one else can see it. So please feel free to participate. And if you have to hop off, we might hop into, slide into dinner time for some people. You will get a link from Zoom in a couple of days stating that this presentation is available on our YouTube channel. I have some polls hidden throughout here and to just be sure that you're staying engaged and participating. So this is a great example of what the poll questions are going to look like. I will post one that ask you a question and you're going to respond accordingly. So who's on the call today? How many first-time moms do I have and how many veteran moms do I have? And then I'll talk for a little bit and I'll say the polls are closing in 3, 2, 1. I will end the poll and I'll share the results. So we have just as many first-time moms as mommy veterans on the call this time, and possibly a couple of people who are not able to vote. So we are going to go over today the things that include the full circle experience, including where we deliver. We'll go through some office protocols, how best to reach us, what to expect at your pregnancy visits. Going to give you lots of prenatal resources. We will go in depth on exercise and nutrition in pregnancy, and then we'll close with an upper respiratory infection update, not just COVID, but it will include COVID. So first, a little information about our practice. So this is a collaborative midwifery model practice, which starts with pregnancy and birth is normal. Pregnancy and birth are normal life processes, not some disease that you contracted that we have to cure you of. The traditional midwifery model is set up so that they care for normal, low-risk women with no pregnancy issues, and if there are abnormalities, then they have to transfer out to be able to access a physician. In the collaborative model, you can still continue to see midwives for your care and have midwives for your delivery. And to that end, most of the deliveries are attended by our certified nurse midwives. But if there is something abnormal during your labor, they will consult us, the physicians. So if it's something urgent, like can't wait till morning, but can wait 15 minutes, 20 minutes, they will consult one of us to come in and take care of whatever the urgent matter is. If it is an emergency, like can't wait 15 minutes for one of us to come in and take care of it. We have OB hospitalists, board certified OBGYNs who are in-house 24 hours a day. And we've updated our stats. We did a little over 600 deliveries last year, and only 4 of them did we require the hospitalist help. And I will tell you the most common reason we need the hospitalist is not because there's something wrong, but because there's something really fast. Like the hospitalist is able to get to you because they're already in-house and you come in 10 centimeters and push a baby out before any of us gets there. So where are these magical hospitalists? Good question. We deliver at HCA Florida Hospital, which was formerly known as Memorial on University. It's only 9 minutes away from Full Circle, and they do lots of tours so that you're able to see the facility. Every quarter, they do what's called a stork tour. So you'll see those signs up in the exam rooms, and you can scan the QR code or you can call the phone number on there to reserve a space on the tour. Again, that's only 4 times a year. If those dates don't work for you, what you can do is go to HCA's website and click on register for a class, pick select labor and delivery tour. Brittany is the childbirth educator there and she does tours twice a month. So just pick a date. You may just see the July dates up there right now. Just scroll to the bottom and it says select more dates. And I think she has her dates out there through September already. The office itself is open on Monday through Thursday from 9 to 1. We close for lunch from 1 to 2, and then we reopen at 2 and close again at 5. So if you call us between 1 and 2, it will roll over to the after hours voicemail line. The phone's not broken. It's okay. You can, if you have an emergency, the reason why we do it that way is because the after hours line rolls to the emergency on-call provider. So if you have a medical concern, an emergent medical concern during the hour between 1 and 2, leave a message and the emergency on-call provider will get back with you. If it's something administrative, like I think I'm going to be late for my 2 o'clock appointment, don't leave that message there because she's not going to get that relayed to the front desk. We are open on Fridays from 9 a.m. to 1 p.m. So if you are calling on Friday at 12:53 with something administrative, we may have to return that call on Monday when we reopen at 9. And the question I have is, I'm sorry, Dr. Adams, is the hospital HCA Florida Memorial? Yes, that is correct. That is correct. Next, appointments. We don't do walk-in appointments. Our goal is to see you at as close to your appointment time as possible. And so we can't do that. If we promise you the 10:20 spot and someone else walks in at 10:15 saying, I have something urgent, I need to be seen. So our goal is to treat your appointment time with that same respect. We have limited same-day appointments. Sometimes people cancel, deliver, forgot, and there is a space on the schedule. So if you call in the morning with a problem, the front desk is really good about trying to fit you in on people's schedules. If it is something urgent, though, and we look at our schedule and say, hey, we actually don't have any openings today, we might recommend that you either go to labor and delivery to be evaluated or that you go to an urgent care. It's not us saying that we don't want to see you in the office. It's us saying that we agree this is an urgent matter and it shouldn't be sitting in our lobby waiting to get worked in case somebody no-shows an appointment. When you call, the providers are not able to leave patient appointments to take phone calls because, again, when we're talking to you during your appointment, we would not be rude to get up and take someone else's phone call during that time. So we ask that you show your fellow patients the same respect. You do have to leave a message when you call the office in order to get a call back because people pocket dial their gynecologist a lot. And so we don't call everything that comes back up on our caller ID. So just be sure that you're leaving the message with the right person. If you have a clinical question, like you have questions, a nurse call, some contractions, not sure about baby's movements. Sierra is the one taking those, and she's excellent about responding. She also does FMLA letters, forms, things like that. Our clinical coordinator, Naisha, some of you have already had contact with her. She does referrals, labs, scheduling things at the end of pregnancy, like delivery, induction, C-section, that sort of thing. And she also schedules the circumcisions after the little guy is born. Renee Hall, most of you have met as well. She's our benefits coordinator, and she was the one who showed you that little video when you came in for your confirmation visit. If anything changes about your insurance during the pregnancy, because many of you are going to be pregnant from December, like into January, and if anything changes with your insurance, please, please, please reach out to Renee to be sure she has any updates. After hours, if you need to reach someone from our practice, there is always someone from our practice on call for our practice. So this is the person you call if you think you need to join her in the hospital. So this isn't oh, I think I lost my lab slip. This is the emergency on-call line. You have to leave a voicemail in order to receive a call back. The phone doesn't register that anyone called unless a voicemail is left. The patient portal is another way to reach us, but remember that the response times can take up to 2 business days. So if it's a non-action item, like, oh, I was just wondering whether I can take this supplement, then that's something we might just postpone to answer at your next visit. I lost my lab slip is a good use of the portal because we can send that to our medical assistant. She can email it to you the next day. Or I need to change my visit to from in-person to virtual because I have an upper respiratory illness and I don't want to get the staff sick. Oh, so thoughtful of you. That's a good use of the portal as long as there are 2 business days between the time you send the message and the date of your appointment. Things we don't want to see on the portal, and I still see these things on the portal a lot. Urgent matters. People send me very high blood pressures, concerns about their baby's movement, heavy bleeding. You're not texting us on our phone. We're not getting this message immediately. We have to log into the portal, which is something we don't want to do when we're not on. Like after work, I want to spend time with my family, so I'm not going to be checking portal messages. I usually will check them during business hours and sometimes a little bit later. We ask that you don't send blitz messaging, so don't send the same message to 5 people saying, I'm sure somebody's going to be on the portal. One person will respond to me because eventually we're all going to get to it. And we had someone very upset that she had 5 prescriptions at the pharmacy, but she messaged 5 different people about something. And so she got a lot of response eventually. and her pharmacy kept blowing up her phone. Also, if you're sending multiple messages to one provider, please try to keep it in the same thread because, again, 70 portal messages later, if you just send me a message, 70 messages from different people later, if you just send a message that says, now what? I don't know what we're talking about anymore. So please keep it in the same thread. You can reopen a message to reply to it if you want to continue a conversation you were having with the provider before. We do ask that you don't try to have an appointment over the portal. Text yourself questions or schedule an appointment. Like if you're sending a bunch of labs asking for our opinion, pros and cons on things, that's a visit. So we want to do those during office hours when we are seeing patients at a regular time. Someone's hand did go up, but there were no questions in the chat. So I'm going to keep going to ultrasounds. Ultrasounds are also shared over the patient portal. Now, unless there's something immediately urgent, so Kathleen and Taylor have been doing this for a long time. They know if there's something you should not leave the building and find out about later on. So if we let you walk out of the building, that means your ultrasound was okay, and we can tell you the specifics about it later on. Otherwise, we don't have your report yet. It's just like if we sent you to an outside facility. At the end of the day, the sonographers complete their reports. We download it from the ultrasound, send it to our electronic medical records, divide it among the providers, and then we get to review them and send them out to you. So give us 2 business days to receive them, review them, and respond. You see the sonographers typing, and it makes you nervous, and you send a message saying, "What is on my ultrasound?" I don't. I don't know yet because the report hasn't come to me. If you know that your anxiety is not going to let you wait 2 business days to know what's on that report, try to make your prenatal visit appointment the same day as your ultrasound appointment. They can print out a preliminary report and give it to the midwife who you're seeing, and she can go over the big points with you, and then you get the report later in 2 days. Question I have is, I missed, what do we do if we have an emergency? How do we contact someone? So you just call the same office number. So the office number that you call at any time of the day, if we're open, it rings to us. If we're not open, it goes to the emergency on-call provider. Quest also has a portal, which is kind of annoying because they send the results to you first before we get a chance to look at them. Then you see the results and there's something in red or out of range and it freaks you out and you start Googling. Just remember, red does not necessarily mean abnormal. The reference ranges that they use to say these are the normal values are different when you're not pregnant. Pregnancy creates some physiologic changes that change what is normal. So give us a chance to receive the labs from Quest, review them, and release them to the portal. Don't upload them to your portal yourself. Just give us a chance to get it so that it closes our loop of what labs are outstanding. If you've had your labs from Quest for more than a week and you haven't heard from us, then let us know because there's a possibility that they didn't send them to us at all. But give it a week definitely for us to get them and look at it. Sometimes we do have the labs, but they're not in your chart if you use a different name at Quest or any other place. We ask you to please use the same name at all facilities. It sounds silly, but sometimes you're still in the process of changing your name from a marriage or what have you. And try to make sure that the name that you're using does match your insurance information because insurance loves to say that they have no idea who you are and they won't pay for anything. When you use different names, though, in different places, that guarantees a delay. We don't have a live fax here. Everything from our electronic medical record system goes to Massachusetts, where they sort it by your name, date of birth, and demographics. If those things are different and they don't match, it goes into an arbitrary hold box, which doesn't go into your chart. So that will guarantee that we won't have your stuff to be able to review it quickly. All right, any questions on how to contact us? Okay. Prenatal visits, what to expect. So 1, expect that you will forget all of your questions while you're in here. So start a text thread with yourself to text yourself questions that you want to ask at your next appointment. Wear something loose and comfortable. It's summertime, so that we can access your belly, because at every visit we will be listening to the baby's heartbeat with a Doppler, not an ultrasound, but we'll be listening to the baby's heartbeat. We want you to get here about 5 minutes before the scheduled appointment time so you can check in, handle any front desk business, and go to the bathroom if you need to. Front desk should know, or your medical assistant should know, if you need to leave a urine sample. We no longer have to collect them on everybody. We're now only collecting them on people who were checking for a test of cure, like if you were recently treated for a urinary tract infection, if you have high blood pressures and we're looking for protein, or you have gestational diabetes and we're looking for blood sugars. If you're 10 minutes late, we'll still have time to check on you and your baby, but it leaves less time for our little phone thread chat. If you're 20 minutes late, you've missed the entire appointment. Now, some days, are exceptions. Like today, it was raining cats and dogs, and so everybody was 15 minutes late. But if you've missed your entire appointment and there were no acts of God causing it, then we may be able to work you in later. Front desk is actually really good at saying, oh, she's going to miss this appointment with Colette. There's an opening with Kayla over here. Let me get her in over here. But if none of those times work for you, then we can definitely reschedule to a time that works for everybody. So when are you having another ultrasound? Another great question. So that first ultrasound we did, the confirmation, super cute, was a diagnostic ultrasound. So we needed it to find out when your due date was. And that your baby's heartbeat was okay. So diagnostic ultrasounds are separate from prenatal visits, and they're performed typically by our sonographers. The way to find out whether you have an ultrasound scheduled for next time is to look in your portal and see if you have more than one appointment time and whether there's a provider's name associated with your visit. So Tina Test is my imaginary patient who goes to her portal, and she clicks on appointments and sees that she has two on the same day. So the first one is at 9:20 with ultrasound, which is not a provider's name, and the other is at 10 o'clock with Dr. Yeckel, which is a provider's name. So when Tina comes in, she'll have her ultrasound. She can bring her family with her to the 9:20 visit, and then the sonographer will print out a preliminary report for Dr. Yeckel to review with her at the next visit. Otherwise, the results will be sent to her portal in 2 business days unless there is something urgently abnormal, in which case we will break our schedule and someone will come and talk to you and we'll make a plan for what was seen on the ultrasound that day. When you're checking out from your regular visits, a lot of times your provider, Vanessa or whoever will say, oh, it's time for your ultrasound in 4 weeks. When you go up to the front desk, be sure they are scheduling 2 appointments, one for the ultrasound and another one for a prenatal visit with one of the providers. If you need to see your baby more than medically, diagnostically, we need to see your baby, that's understandable, probably a very cute baby. Boutique ultrasounds exist for this purpose. There are a couple on here for informational purposes, not necessarily, saying anyone that's not listed here is not good. But these are places that do the fun ultrasounds, and those are very cute. And they put the baby's heartbeat in a stuffed animal and give you 3D pictures, all sorts of really sweet stuff. So you can definitely do those. At whatever time. 3D ultrasounds are probably best done in early third trimester. All right, we have another poll question. So when can you expect to have your next ultrasound? Do you get ultrasounds at every single visit? Do you get them only at 20 weeks, 40 weeks? Or do you only get ultrasounds if you have a problem? And the polls are closing in 5, 4, 3, 2, 1, done. All right, so we do not do ultrasounds at every visit. We do a Doppler at every visit. So we listen to baby's heartbeat each time, but we do not, but we don't do an ultrasound. Your anatomy ultrasound is at 20 weeks, and if we see everything we need to see and you don't develop any other issues throughout the pregnancy, the next time you would need one is after your due date, so after 40 weeks, and then definitely after 41 weeks to make sure that it is safe to stay pregnant. All right, we are going to move over to the website now. So let me know when you are able to see the Full Circle website by raising your hand. All right, fantastic. Okay, so I did have a question back there before asking which hospital we were at now. Up here is a banner. We did leave Ascension in 23, so it's been almost 2 years that we've been at a different facility. So in October of 2023, we left Ascension to join with HCA, and it has been a very, very good move. And so if you want to know why, there's a whole town hall that I held about it a couple of years ago, so it's still available to get your questions answered. All right, so providers, one of these lucky people will be there to help you grow your family. There's me, Dr. Marrow, Dr. Yeckel, Dr. Mooney, midwives Lauren, Krista, Cindy, PA Vanessa, midwife Norma, midwife Kayla, midwife Colette. You guys remember Carol? Carol's actually going to be gone again in another week or so. She was helping us out for the summer. She's teaching at JU now, and she's on summer break, and so she got bitten by the midwife bug. Over here under patient information, you'll see the obstetrics tab and you'll see all these bellies. So everything I'm about to go over now is stuff that you'll be able to access by just going to our website. So our delivery statistics are out here from 2018 on, and you'll be able to see what are our rates for cesarean, what are our rates for VBAC. We're very proud of our stats, so that is available for you to peruse at your leisure. We're going to click on prenatal care timeline. So this is what to expect at each visit. So everyone on here has already had their first visit, which we typically like to do between 8 and 10 weeks, where we do a pregnancy test and your dating ultrasound. Then you chat with the midwife a little bit about any pressing issues, and she gives you information on genetic testing. You also talk to Renee Hall about your insurance and prepayment plan, and then your homework is to sign up for this webinar and to then have your history visit with me. So some of you have already done your virtual visit with me where we go over your medical history, pregnancy history, and order your standard prenatal labs. If you opt into genetic testing, you typically order it when you're with me. And then your homework is to try to get that blood work done before you come back in, if it's possible. I know Quest is hard with appointments these days. But at this point in pregnancy, we're seeing you every 4 weeks. So every 4 weeks, so about 4 weeks after your initial prenatal visit, you should be back in the office for your OB physical exam. These are the standard prenatal labs that we order. This is the American College of Obstetricians panel. Cervical cultures are part of that panel. The Pap test is not. So if you are not due for a Pap, you obviously don't need to get one. Even if you are due for a Pap, you don't have to get one either because it's not part of the prenatal panel, and you're welcome to defer that until after pregnancy. After you've spoken with me at your history visit, you'll typically meet with the high risk doctors if that is your if you have a high risk issue. I usually send that referral after we've discussed your medical and pregnancy history. Then about 4 weeks later, we're in second trimester, yay! And we talk about second trimester stuff, which will include another 4-week visit that we do a mental health screen. So we don't just wait for these for postpartum, because postpartum depression, has gotten a lot of publicity. But antepartum dysphoria, like not feeling like something's not quite right, anxiety, rage, those are all real too. And we want to get ahead of it and not wait until you're in a postpartum spiral. Your anatomy ultrasound, as I mentioned, is around 20 weeks, and if you're meeting with a midwife at that time, she's going to start talking about childbirth education and breastfeeding classes. Then about 4 weeks later is about time for the glucose test, and I know I'll have questions about that, so just put a pin in that. Hang on for a second. We're going to talk about that in depth. For my moms who have an Rh negative blood type, we want to make sure that either we already know your baby is Rh negative or your husband is Rh negative. Otherwise, we want to secure RhoGAM for you. This is when we're going to have you complete your hospital pre-admin forms. Those of you who were at Ascension before, you remember it was just a piece of paper that you wrote on and mailed off into oblivion. Everything is online now. So when you're registering for the hospital, you're going to scan the QR code at the front desk and put all your stuff in online. If you haven't already taken a tour, you want to do that right around this time. And if you haven't already selected your doula, you want to make sure you have it solidified by the beginning of your 3rd trimester, which is here. You'll see in the middle, there's the option to repeat or decline your standard prenatal labs. So these standard labs that we did back up here, American College of Obstetricians, ACOG recommends doing it at least once. In certain high-risk populations, it's recommended to repeat it later in pregnancy. If you feel that you're not part of the high-risk population, there is a form you can just sign to say, I don't think I need to do it again. First-time moms, this is when you want to find your pediatrician. We don't have a list of pediatricians per se. We have a bunch of business cards at the front of the office. So when you come in and you're looking for your pediatrician, when you come out of those bathrooms, there's a line of business cards, a bunch of cards there. Just pick anybody there. This is when we start seeing you every 2 weeks. So every 2 weeks until 36 weeks, if you have some pregnancy complications like high blood pressure or diabetes, we start doing additional testing. If you're planning a belly birth, which is our term for the C-section, we will typically start looking for your date right around 33 weeks, so we have you scheduled by 39 weeks. Most belly births are between 37 and 39 weeks, depending on your specific circumstances to why you're expecting it. At 36 weeks, we do one more pelvic exam for group beta strep, and we'll explain what that is and why it's important at that visit. And if you've opted out of repeating your STI screening before, you can opt out of repeating the cervical cultures again. Now, we start seeing you every week. This is when we're in the home stretch. So if you have a birth plan, like birth preferences, this is when you want to bring it in, talk to the midwives about it, start your natural cervical ripening methods. My belly birth ladies will be getting off the train about here, and then those who are waiting for labor are going to be patient. All passengers evicted by 42 weeks. For twins, 39 weeks, but for singletons, 42 weeks. So for first-time moms, your average length of labor is about 24 hours, and it can sometimes take us 24 to 48 hours to get you into labor. So we start with you at about 41 weeks and 5 days. For second-time moms, your labor is usually half the length of your first one, so 41 weeks and 6 days for you. So remember, that is what to expect at each visit, no surprises. So you can always consult that before you come in for your visit so you know what should be ordered. All right, next poll question I have. If you have a headache, are you more likely to take a Tylenol? Are you more likely to meditate? Or would you just go to the emergency room? You've never had a headache before. All right, and the polls are closing in 5, 4, 3, 2, 1, done. All right, we have a few more medicators than meditators this time. That's uncommon on these calls, but I am also I'm Team Tylenol. All right, let's take a look at pregnancy safe medications because I know some of you have already reached out with some of these concerns. And over on the left, we have in alphabetical order common pregnancy discomforts. Relief measures are what we're going to recommend that you try first before you go to any medications. So these relief measures are things that you can do, just kind of lifestyle changes or things that you can purchase. But then over here, if those things aren't working, these are the things that are safe in pregnancy for you to take, along with some caveats, things to avoid, no pseudoephedrine, Pepto-Bismol, Lomotil. And if you're having nausea, vomiting, I'm just going to highlight this one. Please call us if you can't keep down food or fluids for 24 hours. Please don't keep trying to take ginger if it's not working. You'll get terribly dehydrated, and that's not good for you or for baby. So just remember, this is out here. Sometimes when y'all send a message, I'm constipated, is there anything I can take? The first thing I'm going to do is ask you, have you tried everything on the website? Because y'all are getting slick now. Some of you are sending messages. I've tried everything on the website. What else can I do? Because remember, 2 business days each time you send a message. All right, the next thing here is gestational diabetes. I'm not going to click on this one to go through it, but just to show you that this is where you're going to find all the instructions for when you do your glucose tests between 24 and 28 weeks. And the question I have on the floor is, if opting for genetic testing with gender testing results, how long does it typically take to get the results back? 12 to 14 days. So usually your regular prenatal labs come back first, and then the genetic testing comes back about a week, week and a half later. Good question. Weight gain in pregnancy. So I've had this question as well already. So I started, like some of you were on your way losing weight and you were excited, and then pregnancy happened. And you're like, I don't really want to lose all my momentum. You can plug in your pre-pregnancy height and weight into this calculator here, and it will tell you how much weight you should be gaining in pregnancy. If you have twins, you can add 10 pounds onto the upper limit of each one of these. But look over here, the rates of weight gain are in your second and third trimester for pounds. So if you haven't gained anything in your first trimester, don't let it freak you out. Whatever number you are going into your 13th, 14th week, that's your start. And so then your weight gain is this number then after whatever you reached your low, so to speak, in your first trimester. Birth preferences. So let's see. Especially for first-time moms. If you have, like, you've never done this before, so you may have some anxiety about what's going to happen. Sometimes it really helps to just write down your thoughts, get some things out about what's important to you in the birth. So everything from, what do you want to wear when you're in labor? How do you want to be monitored? What do you want to do for discomfort related to your contractions? Some things to highlight. We're not starving you. We're not strapping you down to the bed. You have options like if walking around, sitting, lying down, squatting. I don't care. You can push in any position, deliver in any position. That's fine too. Our standard is delayed cord clamping, immediate skin to skin, early latching. But if you want to do something different, just let us know. The standard medications that are offered to babies here are listed. You all have the opportunity to come in and talk to the midwife about what these medications are. Is it right for you? Is this something that applies to me even? And what if I want to delay? And the question I have now is, can you deliver in any position if you have an epidural? Theoretically, yes. Like we won't stop you from getting in another position. It just may be hard to do. It depends how dense the epidural is, whether you're able to get onto your hands and knees and support your weight with the epidural. But we won't say you're not allowed to try. It's just, if it's mechanically safe. So other things down here, these are 21 boxes. They won't all apply to everybody because there's things down here about twins and belly births and circumcision. So take it one box per week and, come back and get back with us about what things are important to you so we can all just kind of set expectations about what to look at when we go into labor. Cervical ripening techniques. So at the end of pregnancy, you are going to be looking for anything that will help you go into labor when you pass that due date that you've been focused on, laser focused on for forever. These are things you can start as early as 20 weeks. These are all pulled off of evidence-based birth, so you can just take a look at them, because it tells you when there's good research for it and not. None of these things are harmful. They're also not meant to put you into rip-roaring labor. These are things that are going to soften your cervix, thin your cervix out so that when your baby gives the signal for labor, then your body will be more receptive to it with better and stronger contractions. Question regarding who is on the call. How many moms do I have here who had a previous C-section that are going for a vaginal delivery? Okay, all right. You see, there's only two choices. Either it doesn't apply to you, so first-time moms, I know that's not you, or yes, and you're going to rock it. So fantastic. All right, so we do have a couple of VBAC moms on here. So this is actually for VBAC moms and for first-time moms. Control what you can. Babies are going to baby. There's nothing you can do about what the baby does. But controlling all the factors you can to reduce your rate of converting to a cesarean. Position, position, position. Position is more important than size when it comes to avoiding a cesarean delivery. If you had a C-section before and you're, nervous and struggling with that, look for a fear release mediator. Rebecca McKinney does a really nice fear release course. Look for a Webster certified chiropractor as early as second trimester to start getting your hips aligned so the baby can be in the right position. The most common reason we do C-sections is not baby in distress, baby's too big. It's babies in wrong position to be able to come out. And they just get stuck and their little heads just won't turn. And we end up having to go to cesarean. If you come in with your water broken, first time mom, and your baby is in an awkward head position, if we can't get that head to fix or rotate, your chance of delivering vaginally is about 5%. So the position, I cannot preach enough about how important it is, and that's for VBAC moms too. So Pilates, Bradley method, squats, watching your weight gain, getting an experienced doula. Don't cheap out on the doula. You get what you pay for. Spinning babies, put your baby in good position. These are exercises along with the mouth circuit. Acupressure. Don't get exhausted and tired of being pregnant. Just trust us and trust that we don't want to mess up our stats either, but we want you to have a safe and healthy delivery with as much autonomy as we can preserve for you. And then finally, circumcision. If you have a little guy and you want to have him circumcised, we do not do that in the hospital. They're done in the office before he's 10 days old. Typically, we'll ask you about it during pregnancy. But then if like we'll ask you again just to verify after you deliver. And then if you decide yes, then Naisha is going to reach out to you and get your little guy his appointment with us. Okay, let's go back to Does everybody see the Starbucks drink? Raise your hand if you're able to see. Okay, very good. All right, so those who are very concerned about their weight, and Dr. A, I don't know what I'm doing. All I had was coffee this morning. Was it coffee or was it a salted caramel mocha monstrosity? One of my favorite things that I can not have very often. Did you know that pregnancy only requires an additional 300 calories per day? It's not a lot. So when people say, oh, you're eating for two, eat twice as much, please don't, because the American diet was already eating for 1.5, and then adding another 1.5, you're eating for three. Your baby's going to take 300 calories in the beginning, and you get to keep the rest. Happy Mother's Day. But then toward the end, your baby will put on weight too, especially with carbohydrates and with proteins, heavy proteins. It only takes 10 calories to maintain a pound of body weight. And your goal for pregnancy weight gain, as we saw before, is based on your starting body mass index. So if you're starting the pregnancy at 170, it takes 1,700 net calories to maintain that. So if your goal is to gain 25 pounds during pregnancy, that's 250 additional calories you can have. Yay. So 250 plus that 1,700, it's 1,950 for the day. And let's say that we are dividing it between breakfast, lunch, and dinner, 650 calories per meal. Now, once you've had that 650 calories to eat, you cannot drink an additional 500 calories to wash it down. Drinking your calories is a very sneaky way that pregnancy puts weight on us because we're always thirsty and it's hot and it's summer and it's Florida and we're pregnant. But also just watch the caloric intake from the drinks. This slide is a little busy, but it just emphasizes that when you're getting those calories, be sure that they're coming from good sources, not high carbohydrate numbers and not high fat numbers. The one over here on the right is more about how little choices can make a difference. So when you're trying to limit your sodium so that your rings fit throughout pregnancy, changing from traditional spaghetti sauce to 20-minute herb-infused marinara tastes pretty close to the same, and you can save 500 milligrams of sodium, which is major. So eat your fruits, your veggies, your whole grains, your cereal. You won't give your baby an allergy to nuts or dairy if you eat those during pregnancy, so carry on. For my coffee drinkers, less than 200 milligrams per day. So a Starbucks tall has about 55 milligrams. So that's still a pretty decent amount of caffeine. Just keep in mind, if there's anything that we're saying limit, it could have a negative effect, and that's why. So a lot of caffeine toward the end of pregnancy can give baby irregular heartbeats. So just keep that in mind. And if you can wean off, then that's always better. It's also a diuretic, so drink 3 times as much water as you are any caffeinated beverage. Herbal teas are fine in pregnancy. These are our favorites. Raspberry leaf, as I mentioned before, and then there's ginger, lemon, and peppermint. For my pescatarians, my vegetarians, my vegans, be sure you're eating around 70 grams of protein a day. There are some pregnancy diets out there that encourage you to eat like 120 grams a day. Please don't do that. You will grow a 10 or 11 pound baby. And that's just not that's not our favorite. I mean, I'm sure if you'd prefer an 8 or 9 pound baby. So 70 grams is your sweet spot. You don't want to restrict it because you don't want a little scrawny baby, but you want to get enough that you are nourishing your little one or ones. You can have deli meat as long as you microwave it 30 seconds. It does not have to be fresh out of the microwave and piping hot. Just be sure you get your 30 seconds in to reduce any bacteria. Soft cheeses, as long as they're made with pasteurized milk, are okay. So if you're at a restaurant, you can't verify how the cheese was made. Maybe we don't eat the brie that night. But if you have a cheese that you are buying from Trader Joe's, you flip it over, you see it's made with pasteurized milk. Enjoy. You can have 3 4-ounce cans of tuna per week. If you are a pescatarian and need to eat more fish and want to know which fish are good, bad, or indifferent, the FDA has a very nice document that it has not been updated since 2021, so that this is the latest iteration of it. But it tells you what fish you should eat a lot of because it's high in DHA, which is good for baby's brain development, which ones to eat in moderation because they're kind of neutral, and then which ones to avoid because of methylmercury content. No matter what fish it is, cook it. So we don't want to be eating undercooked fish or meat. So if you are a foodie like me and you love your medium steaks, perhaps steak is not for you during pregnancy, or you can choose to ruin it and have it well done. for the next several months. My kombucha drinkers, my kimchi eaters, those are mildly fermented, so limit, if not eliminate those. Alcohol, you definitely want to eliminate because of fetal alcohol syndrome. We do not know what the exposure amount is. And you want to keep your sodium at under 1,500 milligrams per day, because when y'all start sending me messages in third trimester talking about my rings don't fit, my bracelet doesn't fit, the first thing I'm going to ask you is, what did you have for dinner last night? And you're going to say Chinese food. Any questions about food? All right. What about the Olipop probiotic sodas? Ooh, good question. So if they are raw cultures, you want to stay away from them. I have not looked specifically at the ingredients in those, but it's the raw cultures that you want to stay away from. All right, exercise in pregnancy. So it is just fine to continue doing whatever you were doing prior to pregnancy. If you had a physical job, you can keep doing that as well, lifting things, squatting, whatever. If your pre-pregnancy weight was couch surfing, it is okay to start a new regimen. You don't feel like it in first trimester. Everybody gets a pass until about 14 weeks with me, but in second trimester, you're going to increase your blood volume by like 50%. That increases your oxygen tension and saturation, and so that'll accommodate more aerobic activity. So just listen to your body and ramp yourself back up after we get out of first trimester. You can start something new in pregnancy. So if you weren't doing anything, please start a walking regimen, because staying sedentary leads to a malpositioned baby. And I cannot stress how important position is to getting this baby out vaginally. If you have one of those Fitbit watches and you're watching your heart rate, it'll go up 10 to 15, 10 to 20 beats per minute, and that is normal and physiologic. If you are not getting dizzy or passing out, not a big deal. If you're walking for your exercise, walking is exercise if your heart rate is in the aerobic zone, which is 70% of your maximum heart rate, which we calculate using the number 220. So if you're 30 years old, you should not be exercising with your heart rate consistently above 190 beats per minute for long periods of time. 70% of 190 is then 133, and that's where your aerobic zone begins at the age of 30. So 30 minutes, 3 times per week, you want your heart rate between 133 and 190. So if when you're walking, that's your heart rate, then this is exercise. If when you're walking, your heart rate stays between 80 and 100 like it always is, this is transportation. It's good for some things, but we can't call it exercise. We can't call it aerobic exercise. So safe pregnancy exercises, go for the cardio. You can do treadmill, elliptical, running, swimming, indoor bike. If you have a Peloton and you follow Off My Meds 8, that was me, but you probably won't see me on there anymore. It's been so long. You can lift whatever you were lifting prior to pregnancy. You don't need to increase your resistance during pregnancy because your baby and your body will do those. And if you're already squatting, keep squatting. Squats are my favorite. They get the pelvis open, get everything long and lean so baby can, again, descend in the right position. So you want to work up to a minimum of 50 squats a day, though. If you're not already squatting, at 20 weeks, you start with 5 a day. At 21 weeks, you give me 10 a day and work your way up to a minimum of 50. Pilates and yoga are also two of my favorites. Again, think about stretching those muscles and opening up that pelvis, and any experienced instructor will be able to tell you what the pregnancy modifications are. What you want to avoid is the high intensity interval exercises after first trimester. So it's not the interval, it's the intensity. So you can do the low impact version of these. And then you want to avoid things that have you lying flat on your back for excessive amounts of time. Like you can do ab work, you can do side lying abs or standing abs, but just nothing that has you lying flat on your back. Unless you're a hot yoga instructor, you may want to stay away from hot yoga. If you're not fully acclimated to that environment, you will get dizzy and possibly fall. We don't want you to fall on your belly. Scuba, high altitude hiking for decrease pressure and decrease oxygen to you and to the baby. Please do not take up kickboxing during this time. Contact sports are a no. Pickleball has also been really weird. We've had some strange pickleball accidents. So anything with a ball flying at you. Outdoor biking after 16 weeks is not a no. It's just to be careful. Your center of gravity changes then. And as you turn corners, you may find yourself kind of tipping all the way over with that. Question I have out here is beginner step aerobics fine? Yes, as long as you are doing the low impact version. So if you're hopping up on the step, then don't. You'll want to just do everything on the floor. So the stepping is okay, but just it's the impact part. All right, now that we've talked about exercise and we've talked about nutrition, I have a question. Can you prevent gestational diabetes by just doing diet and exercise? Like, can you get out of it? And the polls are closing in five, four, three, two, one, done. All right, there are two people who have probably done this webinar with me before, and they know that the answer is no. The key word here is prevent. You can manage with diet and exercise, but you cannot prevent it, and I will tell you why. The reason why we screen everybody for gestational diabetes is because you're gestational. So your risk factor is that you have a placenta, and the placenta gives off hormones that tell your insulin not to do its job. The job of insulin is to clear your bloodstream of glucose to use it for energy. When your insulin doesn't do its job, then you have all this extra glucose just out here uncleared. Extra glucose is what? Diabetes. But it's gestational diabetes because your placenta made you do it. So for my moms who say, but I never eat any carbohydrates at all, you eat fruits, you eat whole grains. Don't avoid those prior to the test because you don't want to shock your system into getting a false positive when it's really just because you hadn't had any fruits or whole grains. If it's the drink that bothers you, we have different options for the drink. So the Simply Pure is soy-free, dye-free, gluten-free, BBO-free, kosher, vegan. That is for sale here at Full Circle. You can purchase that from us. There are also other patient-driven options. So remember that square that I clicked on and I said, these are all the instructions for your glucose test. When you get to that, there's fresh tests, there's glucoorganics, and there's glucose tabs on there, and the links to each one of them are on there. They are usually on back order, so this is something you want to decide around 20 weeks, and then let us know if you're going to do an outside test because Quest doesn't allow outside drinks. They only LabCorp, so we'd have to send you to LabCorp to get that done. Childbirth education classes. So for those who are planning unmedicated deliveries or just trying not to get the epidural so early so that it slows down your labor, Lamaze, hypnobirthing, hypnobabies, not bathing. Mm. Um, these are some options out here that are available. Bradley method, I think I mentioned too. Breastfeeding classes are also offered at HCA, and La Leche League has some too. So ask your midwife. Every new parent should know CPR. Here is a link to the Red Cross to take a CPR class. And if you're already seeing a chiropractor, good for you. If not, or if you're not sure, be sure that he, she, or they are Webster certified because that is a special certification to the changes that your body goes through during pregnancy to make sure that the adjustments are still safe. So with regard to pregnancy support, how many of you are planning to work with a doula? I know some of you I talked to, you already have your doula, and that was very impressive. All right. Question polls closing in three, two, one, done. All right. Okay, so some of you are not sure what a doula is, and so we'll talk about that. But at least a couple people have already decided that they are going to work with a doula, and that makes me very happy. So, people say, well, why do I need a doula? I have a midwife. Well, your midwife also may have two other patients in labor at the same time. This is baby season, y'all. I don't know what is happening if all the other OBGYNs are retiring, but it's very rare that we only have one person in labor at a time. And your midwife is dedicated to the medical safety of each of the babies at the same time. Your doula is dedicated to your emotional and physical support during labor at just you. You are her only client at that time. So they provide your physical and emotional support before, during, and after pregnancy. So helping you with your breathing, getting in different positions, hip squeezes, relaxation techniques. So obviously excellent for someone who wants an unmedicated delivery, but also really good for someone who has birth anxiety and just needs to know, I've never been in this situation before. Is this normal? Is that beeper supposed to be going off? Am I supposed to be hearing or feeling this? Doulas are like your safari guides for a safari that you've never been on before. They're not clinicians, so they're not giving you medical advice or providing medical care. They're more helping you process your feelings about the medical care that your medical team, are recommending. So they're not writing prescriptions and they don't deliver your baby. That's what your midwife does. Your midwife does all of the things on here as well as your physician. But your doula is that's why you would have two different things. And we're emotionally supportive too. But I mean, doulas are right. Like the best ones I've seen, they're with you from that first contraction until the time your baby is latched, and they come see you for postpartum visits and all those wonderful things. So ask the midwives. They have no shortage of opinions on who our favorite doulas are, that we've seen support our moms in the best way. Acupuncture and pregnancy massage are also just fine. They're wonderful for sciatic pain, back pain, nerve pain, even nausea. And then at the end, there are also special pregnancy come out massages and acupuncture treatments that I have seen and actually had, which worked for my third baby. Most of your insurances will cover breast pumps. So when it's about that time, 20 weeks is a good time to start working on it. Please scan the QR code in each of the exam rooms to sign up for a breast pump. Please don't go find your own company. They send these long, ridiculous forms that have nothing to do with anything and take forever to get it to you. This is a company that we found. We get no kickbacks from it except for a lot of our time reclaimed. So you scan the QR code, put your info in. They will send you which pumps your insurance covers, write the script for us. All we have to do is sign it and send it back. If someone in the family is using FMLA, Family Medical Leave Act, let us know. Sierra will connect you with Leave Guru. We're now doing this through a third-party vendor because they can get the forms to you in less than 24 hours versus the 10 to 14 business days that you were waiting before. And if there's any problem with the form, that is literally all they do. So they will take care of revising that form as many times as you want without me having to do any of it. And that makes me happy too. After you have the baby, because one day you will have the baby or babies, you'll come back for a blood pressure check if you have any blood pressure issues during or after delivery. Usually that's within the first 4 to 7 days after delivery. If you had a belly birth, we'll see you in 2 weeks after delivery. Routine mental health screen we like to do a little after 2 weeks because baby blues, about 80% of women are going to have some baby blues. That is normal. If you find that those feelings that you're having aren't equilibrating after 2 weeks, we may be looking at postpartum depression, anxiety, or rage. And those are things that we want to identify on a mental health screen because the motherhood space is an amazing resource in Jacksonville. There are counselors we can send you to. We have lots of postpartum resources. Postpartum doulas are also a thing. So emotional and physical support, yes, please, especially right after I had a baby. There are these magical women who come and stay at your house and feed your baby during the night so you can get some sleep. So we have information on postpartum doulas. And then pelvic floor therapy, which is standard of care in many countries. We have a nurse who comes in here Tuesdays, Wednesdays, and Thursdays, and Tracy will help you put everything back to as close to where we found it when we first met you. But pelvic floor therapy is great for post-delivery incontinence of whatever. Also great for discomforts with intercourse when you're going back to your regular life after delivery. So frequently asked questions means we're almost at the end. You can sleep on your back, you can sleep on your left, you can sleep on your right. That's right. We just don't want like delivering on your back is actually what we try to avoid. If you're sleeping on your back and it's making you dizzy, get a wedge pillow off of Amazon and just shove it under one hip, and that way you can't sleep on your back. You can help paint the nursery as long as you're wearing a mask or it's a well-ventilated space. You can take probiotics and prebiotics. You can dye your hair as long as, like that question before, as long as there's not a raw culture. You can dye your hair, including your eyebrows. You can do gel nails. If you're in the salon, though, and there's a lot of fumes, you might want to wear a mask just to keep from getting dizzy and passing out. Summer crew, y'all are going on all these trips coming up, and you'll also be pregnant over the holidays. You'll be pregnant over the holidays. So after 37 weeks, please do not try to go to other people. Really, after 35 weeks, don't go to other. Make them come to you. Car travel is fine up to 37 weeks, which is considered full term. Just be sure that you're, getting out, stretching every 2 hours, drinking lots of water. Also, your baby doesn't know that you're 37 weeks and not 40 when you expected to have your baby at full circle. So you go to another city and you end up with somebody that's not us. So please stay in town. Thanks. For skincare, you can use all of your benzoyl peroxides and salicylic acid, just nothing that has retinol in it. An alternative is bakuchiol, Bakuchiol, has all the good properties of retinol and nothing harmful for baby. Air flight. For twins, up to 32 weeks is fine, assuming no other complications. Same thing for singletons, up to 36 weeks, assuming no complications. Just please, please, please be sure you are wearing your medium compression hose. You're drinking lots of water throughout the flight, like to the point where like you should get the aisle seat so you don't have to keep walking across people and getting up to go to the bathroom. And then when you're in your seat, every time you think about it, do some toe raises to exercise and squeeze your calves to make sure that you're keeping your blood circulating well. No roller coasters, no water slides. Y'all are my summer group, so these are your frequently asked questions. Last thing is our upper respiratory update. And with regard to vaccinations that are out there, ACOG strongly recommends versus supporting either way now, based on 35,000 women studied in April of 2021. Moderna and Pfizer are fine. We don't recommend Johnson & Johnson because it has an independent risk of blood clots, and so does pregnancy. So if you're planning to get a booster in your third trimester, that's the best. Like early third trimester is the best time for any boosters. There's no optimal time versus getting, say, flu vaccine, RSV, or your Tdap. But that's the best time because you'll make antibodies that you can pass through your breast milk after that. So if you're more than 6 months past your initial Moderna or Pfizer, you can get a booster. If you're more than 2 months past your Johnson & Johnson, just don't get another Johnson & Johnson because of the blood clots. So mixing and matching is okay. If you do get COVID, we don't have recommendations for ivermectin, azithromycin, or Plaquenil. So what we recommend, though, is one, not to come here, then vitamin D3, and also not to come here, and then zinc every day, and please don't come here, and then vitamin C, 2,000 international units, and also not to come here. Low-dose aspirin, you can start an 81 milligram tablet from the time that you are diagnosed until 36 weeks. If you're diagnosed with COVID after 36 weeks, don't start the aspirin because you could increase your bleeding risk. And then because we have seen a lot more hypertension in people who contracted COVID during pregnancy, we also do serial growth ultrasounds to make sure that baby is still well perfused. If you contract any of these upper respiratory things that are going around now, stay home and see our website for cold meds. Call us to convert your visit to a virtual because we do still want to see you and talk to you and check on you. We just don't want to catch what you have. You only need to go to the hospital if you're having difficulty breathing or a temperature that's greater than 101. Some of y'all may remember when like COVID was early before, and everybody, like everyone came in and had it and gave it to everyone except me, and I was literally answering the phones, doing people's blood pressures, doing their visits, and scheduling them for their next. It was so bad. So please don't do that to us again. Like, just please don't do that to me, because if we're all sick, there's no one to take care of you. So those of you who had your first visit, your first baby during COVID in the hospital, take a deep breath. It's not like that anymore. We're back to 4 visitors in the room, plus your doula, who doesn't count as a visitor. She's part of your birth team. We're not routinely masking in labor unless you are actively positive with COVID at the time of delivery. And even then, we're not separating you from your baby. We give you an isolate and some N95 masks to protect your baby from the respiratory droplets. All right, and our last poll question of the day is, what can you find on our website? The birth preferences, safe medications, what to expect at each visit, or are you a stellar test taker and you know it's all of the above? Fantastic. All right, this poll is closed and you are all brilliant geniuses. Please remember that we are social. We're on all the things that I don't know how to use personally because I feel very old these days. So please feel free to follow us on all of these. And we'll look forward to hearing your amazing rock star birth stories. And I think I have one more question in the chat. I'm on my feet a lot between work and home. It's a good idea to go ahead and purchase some compression socks. Yeah, because the swelling is definitely going to start at some point. I know it's hot during the summer too. They have more breathable compression hose now if you want to take a look for those, but medium pressure is still what you're looking for. All right, no other questions in the chat. Thank you guys so much for rocking with me and staying through this whole presentation. Remember, it is available on our YouTube channel throughout the duration of your pregnancy, and we will see you back in the office real soon. Mwah.